Welcome back for part 2 of our 3-part miniseries. We are joined today by Elizabeth Goacher, physician assistant, Jeremy Davis, acute care nurse practitioner, and Allison Moser, nurse practitioner. Today, our guests will be discussing new therapeutics in the PBC space.
What are you guys doing then in terms of what are you thinking about the new landscape, the two new therapeutics that we have out at this time? I mean, any freeform thoughts? Let's talk about seladelpar first, and then we could talk about elafibranor.
Yeah, so seladelpar's data has great efficacy. It looks, the side effect profile is great. I think the fact that it improves pruritus as well is going to be great for our patients because we all know that ursodeoxycholic acid, although it's been a great treatment, doesn't improve in the symptom management. So I think seladelpar, I'm really excited that that's come to the market and starting to use it.
Yeah, most definitely. It's nice to have a treatment option to where you're actually able to not only manage the disease state, but also manage a really problematic side effect with cholestatic pruritus associated with it. So to have that kind of dual effect, you're as a clinician, you're like, wow, we've kind of solved two problems. And so having a treatment option available that can allow us to kind of take the frustration out of what we do from the patient side and the clinician side, as far as the frustration of how do we keep this under control. It's great to have options like that.
Yeah, it is. It's fun. And it's also nice to see, every so often over the history of liver disease, developed drugs over the past, 10, 15 years or 23 that I've been doing this. You see some of those, like these were the side effects or these were the adverse events, but this is actually turning it all the way around. As opposed to itching being something that's reported as a side effect, now we're talking about the improvement in itching. So it's kind of a weird, what slide am I on? Am I really on, am I really on endpoint or am I on side effects? So yeah, and I think you're right. It's like a twofer. And also remembering that, historically we know about PBC is that the disease biochemically may improve, histologically may improve, but you still have the pruritus, right? So we have a way maybe to think about, at least in our armamentarium, as we figure out how to place these drugs.
Right.
So that was fun. So Allison, you did a great job, by the way, in the session. Thank you very much on the PBC landscape. So we have the two options now currently in PBC that have this same kind of MOA. So we have elafibranor. Anybody want to, Jeremy, what do you think about what you saw about elafibranor?
Yeah, so the data was pretty promising on that as well. Having an opportunity to have two options available. So the data was really promising as far as the response of getting patients, especially getting that alk phos down to, less than 100 was very interesting. I think with the landscape as far as what our treatment goals are and be able to get attainment to that is very encouraging to me.
Yeah. And it's also, it's just one more thing too. Now I think we're going to have to figure out where to place these things, right? How do we figure out what drug for what person and what scenario? And I'm interested to see how things play out over the next few months with payers, I think, basically, right? Really
that's the big bolt. Yes.
Yeah, the big question. Have you guys have you been able to get people on therapy with either one of these?
I've started a few patients on seladelpar. The nice thing is we have a specialty pharmacy at our hospital, so we have access to that medication, which has been great. Just started them on it, so we haven't had a follow-up yet.
See what happens. Yeah.
But it was very easy to get. The access was great.
Awesome. That's good to hear.
Yeah, I'm naive.
Yeah. And I think historically we've been kind of burned, with the new drugs come out. You've learned, do you wait? Do you? And so it sounds like over time, there's been a really big improvement in how to get these things in the right place, in the right hand. So you're not meeting that. Like right. I prescribed it. It took 3 months. Therefore, I'm not even going to deal with this anymore. I think everybody has PTSD, or some people have, like maybe me, have PTSD, but I think I need to get over it. That's what it sounds like. So.
Yeah, and I think both companies for each drug have great support programs where I think they've done this before, so they know that that's a need. Just reaching out to your sales representative is super helpful, and they'll help you guide through that pathway. So that's great.
Yeah, I do think historically they've learned well how to do that over time. So it's good. It's helpful and reliable, right? I know I can turn to I know who to get to if I have issues. So it's been reassuring. Both companies have been reaching out to be really supportive of our people in need and copay cards and that kind of thing. So.
Thank you for listening. For more information on this topic, please listen to part 3 of the upcoming series.